As you probably already know, there is a lot of information out there on health and wellness, some credible and some not. It is important to make sure that you are locating credible and reliable health information, especially since that information can not only shape your personal decisions about health, but also those you make in a professional setting. Let's talk about validity for research quality. Validity refers to the extent in which a concept is accurately measured in a quantitative study. Valid measurements are generally also reliable, which refers to the consistency of the measure. In order for research to be valid, it should follow the scientific method, which includes an observation, question or questions being raised, a hypothesis being generated, and then corresponding research experimentation and evaluation of that research. Any incorrect explanations would be rejected. The more follow-up studies, the better to confirm or expand upon findings. This brings us to peer-reviewed research. According to the Journal of the International Federation of Clinical Chemistry and Laboratory Medicine, peer review is defined as a process of subjecting an author's scholarly work, research, or ideas to the scrutiny of others who are experts in the same field. Peer review acts as a filter to ensure that only high-quality research is being published by determining the validity, significance, and originality of the study. A peer-reviewed journal is one that publishes research only after researchers who were not part of the study agree that the study was carefully designed and executed, and the results are presented in an unbiased, objective manner. Thus, the research has been approved by peers of the research team. This generally happens before research results are published in scientific journals. Peer review helps ensure that researchers are as objective as possible. Some examples of peer-reviewed journals include the American Journal of Clinical Nutrition, New England Journal of Medicine, and Journal of the Academy of Nutrition and Dietetics. Some examples of databases that contain peer-reviewed articles include PubMed, which is provided by the National Library of Medicine, Science Direct, Cochrane Library, and Academic Search Premier, or EBSCOhost. The college's library database is also a great place to start for locating peer-reviewed journal articles. Make sure to check out the description below for some helpful links about evaluating health claims, peer review, and study types. If you have additional questions about reliable health information, post your comment in the questions discussion board in your course space or send me a direct email.